It can be challenging to talk to children about their health. Health education in schools has to be made age appropriate if we want these initiatives to work. Starting in 2010, the CDC aimed to create developmentally appropriate health information for our schools. Other health initiatives that will improve the health of young boys includes requiring physical activity in schools and expanding mental health resources, providing young boys with a foundational understanding of their health along with physical activity and mental health measures will help to combat the stigma that many men were raised with. This is why it is important to start these health initiatives and focus on men's health starting from a young age. In 2010, the CDC developed a national action plan to improve health literacy. This policy has multiple goals that it aims to achieve, but the most notable in regards to childhood health policy is goal number 3. This goal is to incorporate accurate, standards-based, and developmentally appropriate health and science information in schools for students ages preschool to university. Educating children about health issues can help them recognize the signs of early onset health concerns and protect themselves from other illnesses, injuries, and violence. The CDC acknowledges the importance of using plain language when working to improve health literacy. This is especially true when it comes to implementing this into schools. Age-appropriate language and topics should be considered when addressing health problems with children. It is important to make sure that each child can fully understand what is being taught to them. If the language is not simplified or the topic is too complex, then they will most likely not understand. A federal policy that aims to improve health education in schools is the Every Student Succeeds Act. This was signed in 2015 by Barack Obama. This act expands upon the No Child Left Behind Act and emphasizes a well-rounded education that includes teaching students about their health. Parts of this act describe programs that will focus on healthy living, abuse prevention, and quality training for educators who will be teaching about their health. All of these initiatives will help to improve the health of young boys because we'll start these conversations about health early on, hopefully encouraging them to seek health care and limit the stigma surrounding men's health as they get older. Currently, there is no federal requirement for schools to ensure that every student is enrolled in a physical activity course. The requirements for physical education in schools is left up to the states, with many moving towards making it optional. Studies have found that childhood obesity is slightly more prevalent in boys than it is in girls. This is thought to be due to gender-based stereotypes because boys are often told to eat more in order to be strong. Childhood obesity is an increasing problem in the United States that should be addressed. Public health policies, like a mandate for physical education, can help with this. Physical education is important not only to improve the overall health of students, but to give them a break from traditional classroom settings during the day. Going outside and engaging in physical activity has shown to increase mental health as well as physical health. If the importance of physical health and being active are discussed from a young age, then it will be easier for the youth to continue these habits. Federally mandating physical education requirements in schools would make it easier for schools to make an impact on the health of children. It would mean that every public school in the United States has the same requirements for each child to keep up with their physical activity. This could make a difference in the lack of physical activity among children in the United States because it ensures that all children will at least have the same amount required for school. The Bipartisan Safer Communities Act was passed in 2022 and aims to implement mental health resources in schools and crack down on gun safety laws. This bill acknowledges that mental health services should be more accessible for students and their families throughout the school. Providing these resources will help young boys who are struggling with mental health. Boys are raised to disregard their feelings and feel embarrassed when they ask for help. Having mental health resources in schools will help young boys who are struggling feel more comfortable with opening up if these resources are more accessible. Other policies, such as the expanding student access to mental health services, were introduced or only passed by the House of Representatives. This act would have provided additional support for students in schools who are dealing with mental health concerns. Continuing to advocate for mental health resources in schools will improve the overall health of boys because they will feel more supported. Providing these resources in schools will help break down the stigma that many boys and men face when trying to open up about their mental health. Early interventions for boys' health or health education overall is one of the most impactful ways to make a difference. Discussing the health concerns starting from a young age is important because it will help eliminate the stigma that is pushed on many boys to not talk about their health or emotions. Starting these conversations at a young age will help to normalize these discussions. It can also encourage young boys to adopt these healthy lifestyle choices into their daily lives early on. Providing young boys with knowledge about their health Including diseases and warning signs for illnesses that disproportionately affects them can help them recognize the signs before something becomes too severe. This can include life-saving information about the early signs of depression, cancer, heart disease, and other issues that mainly impact men. It can also help boys pick up on warning signs for their friends, family, peers, and others. Educating young boys and men about their health starting earlier in their life will improve their overall health and help them recognize the warning signs of a serious illness. As previously discussed, men and boys' health is a stigmatized subject. Men often raise their sons on the idea that they need to be strong, self reliant, and not talk about their struggles. While this has gained traction in recent years in regards to men and their mental health, men's health stigma for their physical health is rarely addressed. Young boys and men have increased fears about going to the doctor because they face embarrassment and feelings of weakness when talking about their health concerns. In the past, researchers believed that women were the ones going to the doctors too frequently, but it has recently been found that going to the doctor that often should be the standard. It is the reason why men have higher mortality rates for most of the top causes of death in the United States. Investing in boys' health and starting campaigns to educate them about their health concerns that impact them will improve their overall well being. Having investments in health campaigns and research for boys' health will help eliminate the stigma and make them feel more comfortable going to the doctor about a health concern. It is important to start investing in boys' health at a young age so they will grow up not afraid to talk about their health or seek life-saving preventive screenings as they get older. Implementing health education initiatives that target young boys can help them adopt healthy lifestyles and better their overall health. Policies such as the National Action Plan to improve health literacy, federal requirements for physical education in schools, and early childhood health interventions can help break down the stigma for men's health. Throughout this video, we hope that you gained a better understanding of what Men's Health Network aims to achieve. Thank you.